So tell me about the recovery for a tummy tuck or mommy makeover.
Yeah, so the recovery is you need at least 2 weeks of taking it easy. And most people are not chomping at the bit to do anything during those 2 weeks. So some of the procedures I do, people still need to take it easy for 2 weeks, but maybe after a week, they're like, I want to, go to a concert or whatever, do something that I've already told them they can't do because they feel so good. So I want
True
your blood pressure,
story.
heart rate to stay low for 2 weeks. But for our mommy makeover patients, they're usually not trying to, misbehave because you're still bent over a little bit. You're still stooped. You're sore. You're not interested in lifting anything heavy. It's definitely a longer recovery than most of the procedures we do. Then after about 2 weeks, you turn a corner. So somewhere around 3 or 4 weeks, you start to feel pretty good. And at 6 weeks, you're usually in great shape.
Do you use drains in this procedure?
Yeah, I mostly use drains in a tummy tuck, not for the breast surgery. You can do a drainless abdominoplasty. It can be a good option. I think I don't know. I feel like the drains are in for 5 to 7 days and are not too bothersome. Whereas the alternative to a drainless tummy tuck is suturing internally, which if the patient's thin enough, you can sometimes see some puckering. And if they get a fluid collection, then you need to drain it. So it just has to be the right patient for a drainless tummy tuck. And honestly, I just use in those patients, I'll often they're really thin and we can get away with one drain and it comes out at 5 days and it's no big deal.
And what kind of garments are worn after the procedure? Garments are the worst part. Garments suck.
They do. I think we saw in one of those photos, she was wearing an abdominal binder. We tend to have our patients wear what looks like Spanx. So it's like shorts and then that comes up your torso all the way up. And I think it just does a better job of providing compression and stability than having that like little paneled binder that's like a corset, because that thing tends to either slide up or slide down and is never putting even pressure on where we want it. So I like compression in those little like kind of shorts with, I don't know what you would call it, it almost looks like an old school girdle.
I wish we could do like a video of us trying to put on the garment at the end of the surgery.
Yeah, that's right. You wake up in your garment. So
it's so special.
That's when the magic happens.
It is.
Because let me just assure you, after 7 hours of surgery, the one thing we want to do is wrestle a completely asleep patient in a garment.
Yeah, I think one time Megan had popped in because she heard us cheering because we had got the bra and all 5 hooks at one time. And she's like, what is happening in here? And we're like, we're doing big things.
That's right. Yes, that's a win. So a lot of times the patient will be wearing a bra and then it has a front closure because you don't want to be doing this after breast surgery. And so when we put it on, one person's holding the hooks and the other person's holding the other end. And so we try to get all 5 down.
It's only happened a couple times.
Yeah, it's really hard to do.
It is not easy.
I will say that when my eldest daughter did Nutcracker, it was a professional production and I had to volunteer backstage. I was the go-to for quick change because the ballerinas and ballet dancers would come off on the side stage and they have to get out of one outfit into another and it's all this hook clasp nonsense and I'm like, I got this.
She's like, this is my jam. Say less.
Yeah, you're sweaty, no problem. At least you're standing and able to help a little bit.
Right? Yeah, those asleep patients. There's nothing like it.
Yeah, nothing like it. Also, we're at the mercy of the nurses. So if they haven't set it up for us properly, you can add an extra level of pain. So I've done where we get the garment on and then we're going to clasp the sides.
And it's inside out.
Yeah.
Or like backwards, or I'm like.
So then we have to roll the patient, take it out, redo it, start again. So fun.
Take a sip of Diet Coke first and breathe.
So we complain about putting the garments on, probably only second to the patients complaining about the garments afterwards, right?
Right. They are not comfortable. I mean, I could have a whole podcast on the plastic surgery I've done, but I have worn one. It is not comfortable. It is itchy. It is tight. It hurts your ribs, but it's essential. Helps with swelling. There's so many good benefits for it.
Yeah, I think the compression garment is great.
So after having a mommy makeover, do I need someone to take care of me? How long will I need help?
Yeah. So implied in the mommy makeover, if you're a mom, usually it means you're doing all the things. And so you definitely need a hand. So this is something, even if you can kind of manage your own post-operative recovery and you don't think you need too much help, if you have younger kids, I mean, your job is probably just driving them around and getting them to school, pick up, drop off, getting them things. So making sure you have the support that you need so that people can take care of the other members in your family that need things and also be able to take care of you is super important. So I say, that's not the time for your husband to be deployed or
On a
on an
golf
away
trip?
work. Yeah.
Oh, he'll be gone on a golf tournament that weekend. I'm sorry.
That's not going to work. It generally doesn't work out. I mean, people have done it. It's just you need like a very friendly neighbor or best friend or somebody to pitch in.
You need help.
Otherwise, you're just adding stress to something that doesn't need to be stressful.
Right. Get that help.
Yeah. We just don't like asking
Find your
for help.
husband. So how do I prepare for recovery with little kids at home? Say, I know you want somebody to at least stay the first night or two with anesthesia in their system, but how would after that first couple nights, say I had zero help, could I still get a mommy makeover if I was helping my little kid?
I mean, it's been done, but I would rely heavily on friends and family to help you because who's taking care of little kids? For patients that don't have kids, because we know that, based on their intake, what isn't on our intake is if you have pets, i.e. dogs, and if you have very large dogs. So I know to ask for that because people like fly under the radar like I don't have kids, and then you're like, oh, but I have the Saint Bernard that I have to walk every day.
That's dragging me the whole walk.
Right. So I do ask, or you have a job that you have to go back to that involves lifting things. Those are all things that you just need to think about ahead of time. And so we tell you what your limitations are. We've had multiple patients, right, that live on farms.
Yes.
And have like livestock to take care of, right? We've had patients come in
with kids.
Yes, with kids. And then, are like, oh, our goats had, kids.
Goat babies.
Goat babies the night before.
Kids.
So they were up all night, like helping deliver the goat. I'm like, okay, well, sure. As long as that's out of the way before surgery, that's fantastic. But after surgery, I don't really want you post mommy makeover going in the barn and milking cows.
Delivering animals.
Yeah, have somebody else do that.
Hold my wheelchair, please. So when would you expect that I can go back to delivering goat kids?
I would say for that specific question, probably 6 weeks.
Okay.
Yes. Do not deliver farm animal babies for a solid 6 weeks.
So I can start exercising as well at about 6 weeks?
Yes. At 4 weeks, you can kind of, you could walk maybe or increase your kind of your activity, but going, full court press, which a lot of people in Southern California love to do. You've got your CrossFitters, you've got your, I think it's called Renegade. There's so many gyms. There's Orange Theory. You do not want to be doing that until you're at 6 weeks.
Okay.
It's just a safe move. Don't hurt yourself before you're fully recovered.
Another common question I feel like I get asked a lot is what suture is used to keep the diastasis together? Because they're like, am I going to pop a suture after? I know you do a pretty good suture that's all whipped up in place, but
yeah, that's a good question. So traditionally, most surgeons will double layer that closure. So that means putting one row of sutures, bringing those edges together. So tightening up that abdominal wall. And then we'll over sew it with another suture. So most of us do a 2-layer closure. There's some people who do 1-layer closure. It's just faster. And most of us will do a combination of permanent and dissolvable suture, long-acting dissolvable. Some people will just do dissolvable. So I do a permanent row of sutures and then I oversew it with a pretty long-lasting suture because you really want the suture to stick around for 6 weeks. And once that's done and everything scars in, then you're not going to bust that repair open. It's sort of like a hernia repair, unless something, incredible happens, but you're not going to go do a workout and have that repair fail. But interestingly, they've done, research papers on this and found that, just closing it with one layer of absorbable sutures has the same effect at, 2 months as any of the other techniques. So that's great. But if you have a big cough or you get COVID or something, in that for 4 to 6 weeks before everything heals in, then I would say I like having that double layer of suture to reinforce things. So it's a little bit of insurance. And I haven't had anybody like bust the repair open.
Suture anything. Yeah, I was going to say, I know the answer to that question because I'm the one holding the retractor shaking while she's all the way up.
Yeah, suturing. So
Tippy
it is
top.
important. You can't skimp on that. You have to go all the way to the bottom of your sternum, which is called the xiphoid process, all the way down to your pubic bone. And if you leave the upper or the lower undone, that's going to bulge out. So it's going to look worse afterwards. So that's why you have to repair the whole diastasis. Even though a lot of times your abdominal wall is stretched out, depending on your anatomy, maybe it's more lower, central, more upper, whatever. But you really have to repair the whole thing. Otherwise it won't look good.
We don't want that. I know, because I feel like a lot of people are like, oh, can you just do the bottom or do you just do the top?
No,
right,
we want
right and tight.
We want, yes, right and tight, and we want Brie to get her workout.
You're going to have to show you these muscles one podcast.